A mental health project being run as part of the government's anti-extremism prevent program raises serious ethical concerns. That's according to health advocacy group Medact, which warns that the so-called vulnerable support hubs are encouraging health workers to take on activities beyond their remit.
Prevent training has now been completed over 1 million times in healthcare settings. The results of the only empirical study by Dr Charlotte Heath Kelly on the experience and understanding of prevent training was revealing. Staff differ significantly in their attitudes and their understanding of radicalisation. Given the increased securitisation of health spaces, it is pertinent to question the extent to which healthcare professionals feel capable of resisting policies like Prevent. Most of the NHS staff Dr Tarek Younis interviewed disagreed, to varying extents and not equally, with the Prevent policy. But few spoke out. This is unsurprising. Counterterrorism is underscored by a powerful moral force. George Bush said it best: "You're either with us or against us." As such, most healthcare professionals admitted they preferred not to engage in politically sensitive subjects. This was especially true for Muslims. Given the racism embedded within the fabric of the war on terror, this moral force exerted even more pressure on Muslim staff to conform. The war on terror has marshalled a securitisation of all Muslims, regardless if you're a patient or a professional. Though the Prevent policy was enacted in the NHS with the stated purpose of drawing as wide a net as possible, and healthcare recipients are certainly an enormous group, it is unsurprising that Muslim health professionals felt uniquely anxious during training. Adam, a Muslim psychiatrist trainee, was not as vocal as his colleague Mariam on social media, but was just as apprehensive. He shared his account of Prevent training and why he felt incapable of sharing his thoughts.
There was a fellow Muslim who was there with me during training, and we would often look at one another. It's almost as if they're in a position of power. Obviously, with responsibility comes the power, but how would we react if we were at the receiving end of a referral? And it felt on any given moment, I'm commenting on behalf of myself, that I could be at that receiving end. I'm not the person who's making the referrals, but I'm the person people are referring to Prevent. But for me, it is that kind of, to reiterate, the consequences of being critical, and it's just, you don't feel safe. You don't feel safe. It's just, you don't feel safe. You don't feel that your colleagues wouldn't report you. There is tension during the training session because you don't know if they might be glancing at you and treating you as if you belong to that extremist group. The whole week I remained silent. I didn't want to attract attention. I haven't given it much thought as to why I remained silent throughout. It might be institutional racism, I don't know. But I just wanted to emerge from that training session unscathed as best as I could.
The interviews also revealed that some Prevent trainers were reluctant to conduct the training, given its discriminatory nature. Fatima, a Muslim psychiatrist, said this about her trainer once she completed the training.
The one person that was delivering it said this to me afterwards. Prevent was not something that he particularly wanted to do, or it was just something that he had been told that had to be done. And all he was doing was reading from the sheet, or whatever it was they were told to do. And he couldn't answer any of the questions that, he was quite apologetic about it.
The trainer's apology for giving Prevent training presents a form of the reluctant trainer, when trainers themselves recognise that Prevent may pose ethical concerns, but admit feeling compelled to follow the script they are given. Though these instances are exceptional, their significance merits attention. This is what Jessica, a non-Muslim psychiatrist from an ethnic minority background, had to say about the training.
What I found interesting, frustrating and strange is that she, the trainer, was agreeing with people. She was saying, I have to give this training, but I totally agree with you. It is outrageous. And she's saying, well, I completely agree, and it is Islamophobic, and it is targeting a community, and it's important that we have this conversation, and that's why we're talking about this. But here it is. It's mandatory. I have to give this training. I and a few other people raised concerns about confidentiality, accountability, the lack of evidence base.
What is the use of being critical, Jessica argues, if trainers are simply unwilling ambassadors of an enterprise they recognise to be unethical and the responsibility for prevent is deferred elsewhere? These interviews provide a glimpse into the geopolitics of fear in healthcare settings because of the war on terror. The political employment of fear, a terror threat is imminent, to justify increasingly intrusive policies has led some scholars to call the counter-terrorism enterprise a war of terror, as much as it is on it. Unsurprisingly, fear plays a significant role in self-censorship. Stigma is one mode through which this fear operates. Individuals depoliticize and self-censor in fear of being associated and stigmatized as the other. In Prevent training, the stigmatizing attribute is the very act of critiquing counter-terrorism policies. Unsurprisingly, the then Home Secretary, Sajid Javid, had also likened dissenters of Prevent with extremism.
The threat from terrorism is one of the starkest that we face. Every day, I sign warrants authorizing operations to investigate and disrupt terrorist plots.